I always tell people the first visits kind of are kind of like exploration into what they have going on. Obviously they come in with a condition that they're probably mainly focused on, but that's not going to be the main thing that we're going to focus on. We're going to focus on them as a whole person. A lot of people have many different factors, not just mechanical issues, say like a shoulder pain that they're coming in with. We're going to focus on how does their work affect their ability to do that stuff too, as well as any kind of social factors too. If if they're dealing with a loved one that they're caring for, how are we going to address the painful condition at hand and get them back to doing the stuff they want to do. So we're going to look at everything and develop a treatment plan that's going to fit their goals. It's a little bit easier for us to just be able to call over to any of the providers over on the other side of the hospital just to get their advice, or say, hey, we have a patient here that has something going on, might be worthwhile just for them to stop in and take a look at them. Not only that, but with us having the ER here, if someone comes in and they have a serious condition that we're concerned about, we can refer them right over there and have them be seen immediately. Regardless of the condition, we're going to see you anywhere from 1 to 3 days a week, but there's also those 6 to 4 days in between where we're not going to see you. So we're going to definitely give you homework to work on during that time. And it's really up to the patient. I mean, if a doctor prescribed a medicine and you skip 4 days out of there of doing that, you're probably not going to have the same effects. And it's similar to us, we're not going to overload someone. We're going to give you the core things that you need to work on. And then when you come in here, we're going to push you a little bit more. Having the right mindset, as well as having a good team around you to not only continually educate you on what's going on. Like I said, if it's either a musculoskeletal condition, joint pain, muscle pain, or a neurological condition, having the support to not only teach you about a little bit about your body along the way, but also push you to the point where you're making positive gains. I think that's the biggest thing that we focus on here. If someone has the right mindset, you're going to do well with our assistance, finding the right exercises that's going to get you to where you want to be goal-wise. If you're experiencing any joint or muscle pain, as well as any recovery from surgery, as well as stroke or brain injury, give us a call here at Manning Regional Healthcare Center and we can help you achieve the goals that you want to get back to doing.
Manning Regional Healthcare Center, your trusted experts close to home.